Okay, we are back, and we are going to hear some more from Darian about his story. Allow him to finish it up, okay? Darian?
Yes.
Okay. Now, remember I told you that you would have discomfort during the healing, and like many patients do, you will panic and you say, no, I won't, and then you were concerned. So you want to dwell on that one?
Yeah, I was a little bit concerned, but only because, you had told me that it would take my body a while to slough off the dead cells that would still be around, and that it may be a little bit discomfort, and not to panic and go back to them, and just if I got to a situation where I wasn't comfortable, to come back and see you and we would recheck it. And I did get a little uncomfortable at first, and I called you and made an appointment to come in and check it out, and everything was fine, and you said everything was going the way that it was supposed to be. And it turns out that my concerns were pretty much unfounded, because I continued to get better, actually, and haven't had any recurrence whatsoever. So I guess it's only human nature to get concerned, but you have to put your faith somewhere, and I elected to take your advice and follow the procedure that you asked me to, and it's all worked out for me. I can't complain at all. I have I would have no reservations about doing it again or recommending anybody else to seek this type of therapy, and it's been a wonderful experience for me as far as this type of stuff goes.
Yeah, it was great to see you and see how you're just, it's healing. Yours is healing really quickly, a lot quicker than others. And melanoma can't do that unless it's really advanced. Melanoma can do that. And it's just the fear that everybody has of melanoma is really unfounded. There is a simple way to solve it. I'm glad to see you, that you're back to normal and you're back to life like nothing happened. You're no longer afraid. It's great. It really is great to see you.
It's really great from this end.
I know. Oh, man. I just don't like to see people being butchered, and that's the main reason why I keep fighting, because I'm trying to free people from that kind of slavery. It's just no excuse for it, and so it's great. And it's great that you had the courage to come forward and admit to it and say what has happened to you, because a lot of patients are afraid of the repercussion and don't want to say anything. So that is great.
I got a lot of people telling me that what I was trying to do would not work, and that this was a quacky kind of thing and all that kind of stuff. But, if you'll really take the time to stop and look at what they're telling you, then everything that they're telling you, if you're persistent enough to do the research, what they're telling you is not accurate at all. So, it was a really an easy decision for me, because, I never one time got lied to from you or anyone on your staff, and I was lied to from the beginning with the traditional methods. And generally when there's deceit, there's and dishonesty, then there's something underneath the surface that's driving it. And I just never had that situation with you or your staff or your company or anything that you tried to do. Everything was completely honest and upfront, and you told me what would happen. You told me how I would feel. You told me what would happen when I started to get concerned, and everything that you told me happened exactly the way that you told me it would. And, even though I was a little concerned, I was still at ease to know that you knew what was going to go on, and that if I got too concerned, that I could come back and see you. So it was an easy decision for me.
That is good, and I am really glad to see you back to, I think you even changed job, didn't you?
Yes, I did. I've been doing what I do for 23 years, but I changed locations at where I was doing it, but yes.
Yeah, well, when you do that, you have to be in good condition to be able to do it.
That's correct.
Yeah, so that is great. It's a great thing. And think about the melanoma, how scared everybody is of melanoma. So.
Oh, I tell you what, when this happened to me, everybody I know all went to get checked. I mean, it's amazing how, oh my gosh, if it can happen to him, what about me? I've got these little places on me. I need to go get checked. And I'll bet you 100 people I know within 2 months after they found out what happened to me all went and got checked out. So, the fear is really there.
It is, and it was put out there by the establishment, really. The problem is that if you actually have cancer, if you actually have melanoma, especially melanoma that has all this ramification more so than any other cancer, the problem is if you go in and have the biopsy done, that really spreads it. That's how you got it under your arm, because otherwise you wouldn't even have had that.
Right. I agree.
Yeah. So people have to think about it. Melanoma is really, biopsy are never good, but with melanoma are even worse. So that's the problem. But I am glad that you're doing great and everything is back to normal in your life. So
yeah, I am too. It's been a real blessing. It's been a good experience for me as far as, considering what the alternative might have been.
Yeah, not good. The great Andy Anderson, right?
Yeah.
Do you want to tell people what you saw about what goes on at MD Anderson?
Well, yeah, I can. When you walk in the front doors of the place and you pull up, it looks like a Taj Mahal. You've got marble floors and ivory statues, and everything is just, made to make you feel like they know what they're doing and they're comfortable and they're trying to put you at ease because they've got all of this technology and all of these people and all of this money to take care of you. And then, once you're diagnosed and you get put into a situation where you have to go inside the operation, let's just say more like the underground of the actual facility, you get down there with people that are screaming in pain and writhing in pain and scared, and you hear crying and screams all over the place all the time, and it's real unnerving. It's almost like a medieval type experience, and most people don't get to see that unless they're already involved in it. And when you get down into those places where they're cutting on people or they just come out of surgery and they're picking and prodding and people are, it's almost undescribable. It's a hideous feeling to be, and you're down there with them thinking, oh my gosh, is this what I'm going to be like in a few months,
Yeah.
So it's very misleading, from the first time you walk into what is actually transpiring as the process goes on.
Not to mention the cost.
Yep, and then they're draining you for everything you own. I don't know too many people. I know I couldn't. When I got a bill for $140,000 in the mail, my jaw dropped, and we hadn't even done the process. We hadn't even done the surgery yet.
Yeah.
So it was. It's really sad that people have to go through that and be treated like that. And what really irritates me is that there's a process available where people don't have to suffer like that, but the system not only won't let people know about it and won't embrace it, but they're fighting to shut it down, and it just makes no sense to me.
Yeah. Well, I guess the power of money.
I guess
that's
so.
what it is. I don't know, but it's just disgusting. But when I hear happy stories, though, it's just people that stayed away from the temptation of going back, and they're fine. That is great. And I really thank you for sharing your story, because people need to to hear this.
I agree. That's the reason I agreed to come on. If one person can at least have the courage to try something that will allow them not to suffer the way I was definitely heading in the direction of, then this is certainly worth it. I certainly don't mind sharing.
Thank you very much, and continue on with a great life, okay?
Thank you,
that's
Dr.
the best thing you can do for me. Thank you. Bye.
We'll be right back to The Medical Conspiracy with Dr. Carpenter.